Hello, welcome. It's so nice to be here. I'm so happy that you stopped by to join. Today we have an incredible interview with Dr. Gutwein. Dr. Gutwein, everything that you say during this interview may and will be used against you in a court of law. So, for legal purposes, can you please tell us your name, your position, and the hospital that you work at?
Is this a trick question?
No. Okay, go.
No, stop being a wise guy and answer the question.
Annually. I honestly don't know.
Look, this isn't your program director monthly meeting with the house staff that you don't answer questions. Tell us your name.
Dr Gutwein, Jacobi Medical Center, and Program Director.
Great. See, that wasn't so bad. Now, tell us, how long have you been a program director, and how is it being a program director?
Around 29 years, and it involves a lot of physical effort and a lot of mental concentration.
So, what food do you eat as a program director?
Nuts, certain fruit, Girl Scout cookies.
It doesn't sound like you eat very much. How do you get the energy and motivation to keep doing your job? What do you use?
Heroin, cocaine, marijuana, depending on the state, crack, LSD. Okay.
You know, all that stuff is illegal and you can lose your job and go to jail for using that stuff, especially while taking care of patients.
Make it three.
I haven't followed.
During your interviews with HHC to become the program director, there was some mention that you threatened that if you didn't get the job, you would become a garbage collector. Can you give us a brief job description of what you would do if you were a garbage collector?
Routinely goes house to house to remove waste.
Who is your favorite resident in the whole house staff?
Crystal Engstrom Koch.
Which house staff is the best teacher in the entire program?
Crystal Engstrom Koch.
Aside for Crystal, which other house staff do you think is a superb house officer?
Crystal Engstrom Koch.
Okay, this is getting a little creepy. Are there any hospitalists that you think are outstanding?
Mimosa Meholi.
There seems to be a pattern here. How do you expect the house staff to view their semi-annual meetings with you?
Day of Atonement, where we try to ask forgiveness.
And let's switch gears and talk about your medical practice. What would you do if a patient came in with chest pain and ST elevations on their EKG?
Okay.
Probably start with trying Tylenol, maybe an x-ray depending on the exam.
Okay.
And how do you typically manage a total body Delore patient?
Probably shock him and
Can you give an example of Schedule 4 substances that you need a DEA number to prescribe?
Colace, Dulcolax, Senna.
Okay.
What do you tell your patients who have severe persistent asthma to do to help their symptoms?
Sing in the shower.
It sounds like you may have a lot of bad outcomes from the management you've described. What do you tell the house staff about all this?
Try to find teaching points.
What does HELL spell?
The Jacobi Medical Intensive Care Unit.
What thoughts come to mind when you see all your house staff at graduation?
Syphilis, HIV, and herpes virus.
What are some of the things that you recommend the hospital do to try and encourage more people to come to Jacobi?
Give out methadone to people who are...
Attention, attention, attention. Will the owner of a black Rolls Royce license plate GUTWEIN please report to your vehicle immediately?
Politely excuse myself and go.
Okay.
Well, there you have it, folks. Thanks for joining us for a great interview with Dr. Gutwein. We'll catch you later.
We want you to be as great as you can be, and we love you.